And good morning. Hey, we welcome this morning Dr. Kathleen Wolf of University of Washington, who is actually dressed in her UW colors there, sporting that proud dog purple there. That's for sure. Happy morning to you.
Good
Uh,
morning, Kelly. Great to
Dr.
be
Wolf,
here.
we're so thrilled to have you back again. For those of you that recall that, you spoke to us last November in 2019 about the importance of forest and natural spaces on mental health and on social health. And it was a fascinating talk that our members are still bringing up and chatting about and referencing the sources that you spoke about. This year, of course, we had no idea, right, that in November of 2019, in less than a few months later, right, we'd all be locked down in this strange, awkward, surreal world in which COVID has placed us all in. Um, very excited to hear you share your thoughts on how COVID has affected the mental health issues as we wrestle with being outside in landscapes, um, as well as the increased the pressures on mental health that the COVID environment of this year has created on us, and the outlet that natural spaces might provide for those mental health stresses. And then, of course, that leads to the stresses not just on us, but on the natural environments upon which we're feasting now. That we're actually going out to public places and in record numbers, and perhaps putting a stress on the natural spaces that is an unfortunate consequence of this year of COVID, as it were. So it's a pleasure to have you back. We're eager to hear your thoughts and reflections on this year.
Again, Kelly, thanks for the invitation, and hello to all of you. It would have been great to return in person, but we know that that's really not a great idea. So Kelly's invited me to take a few minutes, share some updates with a focus on mental health. And again, I speak from a basis of science, research, evidence, but for people who work closely with gardens, enjoy being outdoors, you know these things, and because of COVID experience, you know some of the things I'll speak about intuitively. But what I offer then again is, what is some of the science? What is some of the more empirical understanding that we have about these things? And in this time of COVID, public health officials have noted and are writing extensively about mental health concerns. There's the uncertainty of illness, of what is happening within our communities with regard to infection rates and so on. There's the loneliness of, if we observe social distancing, if we maintain our social bubbles, there is a level of loneliness associated with that. And that does have health implications. People are more prone to be ill, and they're also they don't heal as quickly, say after a surgery or a procedure, if they're socially isolated and lonely. And so nature is not the cure-all, but it certainly is an antidote to a lot of this. And again, the research supports that. So on Kelly's invitation, I prepared a few slides. I think I'll jump right into that. But Kelly will now play the role of the audience. So if he has comments or questions while I'm underway, we'll have kind of a conversation around all of this for the next few minutes or so.
Indeed, we will. I look forward to it. Yeah.
All right. I would like to call out that the work that you do as a volunteer, as an individual, and particularly any public nature spaces that you provide, or guidance or assistance that you may provide to homeowners that are working to steward or sustain their landscapes, you're really providing the basis for self-care and community care. These nature spaces are indeed beautiful. Aesthetics are important, but it goes much deeper than that. And we know that intuitively, but again, what I offer is a scan, if you will, of some of the evidence that we can bring to these conversations.
Kathleen, it's interesting how you describe self-care and community care. I don't think we talk about, the very clinical mental health and behavioral health and so forth, but the idea of self-care and community care it seems to have a more personal and impressionable nuance to it.
Yeah, and it makes it more intentional. As we were talking, Kelly, to prepare for this, we've observed, and parks managers are feeling overwhelmed by the number of people that are visiting state parks, local parks, green spaces, trails, and so on. And there's a recognition now that these spaces offer community care because they are places of respite where we can physically distance, but also just getting out and engaging with our community at some level. And the concerns about loneliness during this time, this was recognized from the very outset, the earliest months of the COVID breakout, and it continues to be monitored and observed. And again, the isolation and the frustration, frankly, I feel it myself, the frustration of not being able to engage with people on both professional and personal levels can take its toll over time.
So your point here is that this has been well documented, that we really are running
Oh,
into
yes.
it's a very dangerous, situation that we've got ourselves into here.
And I would say that there are certain pockets or populations of people, so healthcare professionals, people who have to be at the grocery store or the gas station or wherever basic services are provided. There's another level of mental health with their sense of risk of being out in the public quite that much. My daughter, as I mentioned, my daughter is working in a hospital in Juneau. And so just chatting with her, and some days when she'll call literally as she is leaving work and driving home, and the fatigue that she's feeling, as well as the risk of exposure is much more. So what I'm going to do is kind of go really big pictures out, and then generally work in terms of community care and self-care. And some colleagues and I recently completed a review article looking at trees, specifically city trees and health outcomes. And we have lots of complicated expressions of this collection of 200 articles, but here's the basic story. Nature experiences promote general wellness. They help reduce stress. They help reduce anxiety. And that gives us the physiological stamina to resist disease and illness. Then, should we be diagnosed with a mental concern or disorder, there are instances where trees, nature, garden experiences provide therapy. They provide a type of treatment that would not necessarily replace healthcare or counseling, but might be a complement that could reduce the amount of medications that one might need or the costs of some of that care.
So this is this is just the fascinating aspect of this, that the actual exposure to nature, the nature experience actually induces a physiological response.
Yes, and that's been well documented across multiple nations, across multiple decades, frankly, that short term and there's the immediate response, immediate stress biomarkers being reduced when in nature. And depending on the type of experience, the duration of it, and so on, there's actually a buffer period that extends for some time, maybe a couple of hours. One study claimed it was for more than a day or even up to a week. So I start to think about what is the sequence of experiences? How frequently? Do I do this daily? Do I do it every other day? And I think about, or I try to monitor myself. When does this feeling of this restorative feeling start to ease? And then maybe I need to go outdoors a little bit more.
Interesting.
If we look at both general wellness and therapy, the research, again, is wide ranging and shows various benefits. So it's not only mental health, but it's mental function. There is a lot on our minds right now, a lot that we have to process. I mean, even just doing Zoom, I find that Zoom meetings are more demanding of my attention and my mental abilities than our in-person meetings. And I would do way too many Zoom sessions. So for me, nature is helpful in that restorative attention restoration. Creativity, some studies are showing that access to nature during different phases of a project when we're working on something helps boost creativity. Job burnout prevention. A colleague of mine down in Portland has been working with her team at Legacy Hospitals, and they're finding reduced stress in nurses if they take their breaks in a garden within the hospital rather than a break room.
Oh, very
So
interesting. Very interesting
very,
indeed on that. Yeah.
and the implications for that, because burnout, we're seeing that in hospitals now with COVID and increased patient population, burnout is appearing as a risk. But then on the therapy side, there's a number of things that are diagnosed clinically by a doctor, clinician, and that nature can play a role as part of the treatment regime. So let me, I'll now turn to a few examples of these studies. And I won't spend a lot of time on the details of the studies, just to give you a quick impression. And again, because this is a recording, if you'd like to go back and spend a little time looking at these, I've also included the citations should you want to really dig in. But here's a study, and what they did was they randomly assigned people and encouraged them to spend a certain amount of time each week in a place of nature of their choice. And the measures were cortisol, couple of different ways of measuring cortisol. And what they found was that being out in nature did indeed reduce these stress biomarkers. But within this research, what we're seeing trending is the effort to understand dosage. How much? How often? So here they found that 20 to 30 minutes was really an optimal time. Of course, there's greater benefit for a longer amount of time. But this is what they found really made the mark in terms of the stress recovery, the cortisol reduction.
So the point being, it's not a long period of time overall.
No,
It's really just a
no.
modest exposure of being outside.
Yes, and then the point with this too was it was not only one session, but repeated sessions across a period of a week up to the recommended time in the study. Another finding in this that I found really interesting is if people who prior to the study were less active. So there were some people that were like, yeah, this is my routine. I'm out in nature anyway. And others were like, okay, yeah, I'll do this. So for them, it was a new experience. And the stress reduction was even greater for those people who were sedentary
Well,
prior to the study.
that seems very significant in that encouraging people who would not normally get outside and get out to engage with in a nature experience, that it could have it's a fairly profound impact.
It is. So if there's any, opportunity within Master Gardener programs or parks programs to reach out to people like that, to motivate them by way of any sort of program or social connections, there's great value in that. And, for children, so this was aimed at adults, but children are becoming more sedentary as well. So there's a green schoolyard or some way to engage kids. I suspect there might be similar benefits, maybe not stress, but probably other benefits as well.
Most excellent.
This study has to do with some people who are clinically diagnosed with depression, and interesting study done by Mark Berman, University of Chicago. People were recruited for the study. They were randomly assigned. Some walked through a green zone, more landscape neighborhood, others more a residential neighborhood again, but less tree and vegetation cover. And found that people in the more green, more positive mood, cognition, better able to concentrate. So seeing reduced symptoms of depression associated with a green walk. And again, it's a fairly short time, an hour outside to help reduce depression. That seems to me like a reasonable activity.
And what's interesting here is that these are individuals truly were diagnosed, right? With
Yes.
severe depression issues here.
Yes, these are people who would be going to a clinician or a doctor or counselor for treatment for a diagnosed depression. All right. So loneliness is a concern, and I'll wait with this idea until the next slide. This one. So not only being in nature, but the research is suggesting that there's sort of stacked benefits. So physical activity is so helpful for so many uh, potential health concerns. Routine physical activity helps us to control body weight, diabetes, cardiovascular health, all sorts of things, and including depression, as I just mentioned. So what is it about walking and being in nature that might be helpful? So a colleague of mine, Greg Ratman here at the University of Washington, has been studying this idea of rumination. And it's an idea that's prominent in people who treat for depression. Rumination is this kind of the spiral, the inward spiral of negative thought that feeds upon itself. And people who are depressed are more prone to that. So what he has found is that being in nature, walking in nature kind of pulls us back out of this negative spiral, helps to reduce that negative self-reflective thought. And so in addition to that, they found by using brain scans, they found associated changes, positive changes in the prefrontal cortex. And did not find these effects from walking in more built environments. So this is fascinating to me that rumination, I know, in these times of being in my social bubble, sometimes I start into a rumination cycle. I'm like, no, Kathy, come on, back out, go for a walk. And again, just being self-aware of these things can be helpful. You start to recognize, oh, hey, I'm tipping into that. I need a little change here. Let's go out and rake some leaves or something. Huh?
Now, I'm curious about the nature of this particular study. So we're not talking meditation here in a positive sense. We're talking, you have a clinical definition of rumination, right? As you named here, as a damaging, a spiral, of issue. You know, how would Dr. Bratman have kicked off, a study of, gee, start thinking about start thinking about bad thoughts and then go take a walk?
Oh, um, I think I'd have to look back at the study. As you can see, it was about 5 years ago, so I don't remember the details. These sorts of studies um, often make use of journaling or something that asks a person to record over time, or maybe it's a verbal journal, written journal, whatever. Something that records over time what they're thinking about, what is the focus of their thoughts. And then looking at that, and then introducing, so you have the baseline, you introduce an activity or an exposure, and then you watch and see what
Okay.
happens. So a
Okay.
pre-post sort of setup. And then of course, the neural activity that would require some time in a lab, I think. There are some portable brainwave data collection devices, but I think this was a lab. So I'm not so sure how that was done, but he's really on the forefront of this work now, mental health and nature experiences. So Greg Bratman, if you're interested in digging into details, he's published extensively on this idea of rumination as well as more generally nature and mental health.
This is indeed fascinating because I would think even the 90-minute walk by itself, right, would induce some physiological improvements. There should be some
Yeah,
endorphins, right? Just the exercise that you're going to have on that. Fascinating.
yeah, yeah. And recently I reviewed an article, in the world of academia, you submit articles, peer review, but also you get a lot of requests to review other people's work. And I recently reviewed one where they tried to pull apart the nature experience from the walking activity and found that the nature experience was indeed an increment of benefit over walking alone.
Oh no, that's significant, very significant. Yeah, and that
Yeah,
ties back, of course, it really does ties back to the last study you just reported on. Fact that that
yeah,
walking in a nature environment, right, does have market improvements over walking and just strolling down an urban street.
yeah, yeah, yeah. Walking is very beneficial, but apparently this increment of benefit from being in nature is measurable, is detectable. So the loneliness of these times, the possible the isolation, social isolation does and can have health consequences. And in England, there are now extensive programs to promote more social connection within communities. And this is a result of public health awareness of the health implications, thus costs of loneliness. And so now there's a minister of loneliness within the National Health Service of the UK.
A minister of loneliness in the UK.
Minister of loneliness, yeah. And so this person, I don't know what kind of staff they have, but this person has developed guidance for communities and includes group walks. And so not only strolling alone or a small group, but, or your own social unit. But if you're out with a group of people, which we'll be able to do again one day, but what they've detected is lower depression, stress, enhanced emotion or positive affect. And what they found was that this group walk synergizes with physical activity. So again, it's the layering or the co-benefits of the walking and a mental health response.
Was the natural environment a factor in these studies here, or just the factor of walking in a group versus not walking in a group?
Here it was nature versus non-nature. They were both group walks.
Okay.
Yeah. Yeah. This is one study, but it represents some recent research that I find fascinating, as ecologists are now entering this realm, collaborating with health investigators. And some findings fairly consistent that increased biodiversity, increased diversity of the vegetation component around you can improve mental health. And in this particular study, they measured biodiversity by way of vegetation cover and bird abundance. And again, they found lower prevalence of depression. And in this, they actually tracked increments of vegetation cover associated with the benefits. So about 20 to 30% cover was sort of the baseline from which benefits started to accrue. That picture on the right, so I live in Seattle and have been here for some time, grew up in Tacoma, lived in other parts of the country for a while before returning. But my daughter grew up here. And so one day she sent me this picture and said, Mom, you're a birder. Is this Photoshopped? And I'm like, no, indigo buntings. Aren't they beautiful? So I realized we got to get her out traveling to the East Coast somewhere so she can see indigo buntings. But biodiversity,
But
having more living things around us appears to be related to better mental health.
this is incredibly relevant, right, to ourselves as master gardeners, because of course we value the fact of having a rich and diverse, set of foliage and plant life around us, and that does naturally, engage more insects and more birds, into our yards. And so you're saying that this research here, really demonstrates, the positive benefits to ourselves of having just that natural, just the environment that we create.
Yeah, I find this fascinating as well because being in a School of Environmental and Forest Sciences at the University of Washington, of course, many of my colleagues their studies focus more on biodiversity than on human response. But I've learned through osmosis from them about the value of structural character within forests, about ecosystem services, better water management, better air quality, a number of benefits that accrue from having greater biodiversity that accrue to people. And to find that mental health is one of those potential benefits is really interesting to me.
But it's only for afternoon bird abundance. Is that right? I find that curious
Yeah,
here. Is that morning
yeah,
birds and evening birds don't matter?
I know you're pointing that out. When one does a study like this, you have to set up what is a proxy to represent this biodiversity factor. And
Indeed,
so,
I'm just poking
yeah,
fun at the. I
exactly.
appreciate, we truly do appreciate the level of precision, right? The level of science that has to go into
Yes, yes,
validating these, because this is, we may intuitively feel these things and believe these things, but actually now that we're using science to pull apart our actual physical responses to these environmental conditions, it's fascinating.
yeah, and again, the way these studies are designed, I suspect, again, I don't remember reading this, it was a little bit ago, but I suspect that the afternoon bird abundance was related to when the graduate students could get out and observe people in relationship to the environment. So they probably were taking classes in the morning, so they said, okay, afternoon bird abundance, right?
There you go.
So another that I experience and also has been described in research is attention depletion or attention fatigue. And what I mean by that is here I am, or we are on Zoom, and the demand on our ability to focus, to pay attention, this is unprecedented that we are engaging in this way, that we have such directed tasks in our work and in our lives. Think about the complexity of tax forms that are coming up, or any sort of routine reporting you might do in your job, or uh, submitting reimbursement requests, Medicare or health services. Oh my gosh. So we can deplete our attention capacity. And again, I've become aware of this. You can feel frustrated, you can feel irritated, and you can become more impulsive, and you can also become more aggressive. And so attention depletion is a serious concern. And Rachel and Stephen Kaplan, they were mentors of mine at the University of Washington. They forwarded this idea of attention restoration theory, and their research suggests, and it's been, colleagues and students have continued to study this, that being in nature for brief amounts of time, not going away for a weekend, but being in your yard or a streetscape or a nearby park can help to restore that attention capacity.
So just taking a break, right, from the rigor of, a Zoom, a meeting, for example, for a few minutes outside can have a restorative benefit.
Yeah, and the secret to this is, if you will, not taking a break and then scanning your phone, or not take doing do not replace one attention demand with another attention demand, but pursue those benefits that an experience of nature can provide. And the elements of the attention restoration theory, the practical pieces of it that we can build into or design into our green spaces, compatibility, that we feel comfortable and secure, extent, a feeling that it's not confining. And this doesn't have to be really a large space, but a feeling that we can be within and not feel, as I said, constrained by it. But this one, soft fascination, I find really beneficial to myself. And what do I mean by that? It's those things in nature that draw our attention without effort. So my husband and I, we have been gradually putting up more hummingbird feeders. Hummingbirds provide so much soft fascination for me as I watch them feed, but also their territorial, as they're zinging
Yeah.
around each other. Um, textures of foliage, wind, wind in trees, clouds, when we have clouds, right? When you have clouds that are separated, you can see them. But all of these things, if, again, I become self-aware and I intentionally pursue these sorts of experiences when I'm taking a break during the day, be it a glance out a window, if that's all I have time for, or being able to step outside for even a short while, or even go for a walk.
And you're saying that the Kaplans are going to explore in a research basis here of how these soft fascination elements uh, comport to physiological well-being.
They are now retired, and they have been studying this for decades. And it is a widely recognized principle, if you will. Theory often, so in science, theory is something that's fairly well confirmed and well formed. In more popular use, theory is, oh, here's kind of a proposition or a hunch. But their use of theory suggests or demonstrates deep research effort over decades.
Interesting. Okay, so we're confirming that these soft fascination elements, right? That we've described, do have these. That's it's almost an axiom here that they do provide benefit.
Yeah, yeah. And this has been now recognized to the point where it's being integrated into care and treatment centers and integrated into workplaces. Some of our major tech corporations have beautiful, elaborate gardens because of and trail systems because of recognition of this research.
And as you pointed out, we as individuals can take advantage of this simply just by looking out the window, putting up some extra bird feeders, putting different textures and different structure into our gardens so that there actually is this natural calming effect of exposing ourselves to these elements.
Yeah, and I would say in addition to that, creating those spaces where you can pause and enjoy, simple as a bench, something that it beckons and invites one to move into this sort of environment and gain its benefits. And put away your phone. Put away your phone.
That's so hard sometimes.
Oh, so hard. So that's it. I could go on for a much longer amount of time, but I've given you a sampling of some of the research about the benefits of nature experiences and health, mental health in particular. And again, master gardeners, people who are working on behalf of communities for self-care and community care. Thank you, thank you, thank you. So appreciate what you do. I end with this slide. This I took on a tour when I was traveling for business, not happening now, but we went out on a site tour, and these images are 180 degrees. So the open space near this residential area was, done in a very simplistic landscape scheme. But a group of people said, oh, we need more than that in our lives. Maybe they intuitively understood this biodiversity benefit. And so they, over a number of years, have created this small plot within that more formal garden. And look at it, it's got structure, it's got the biodiversity, it's got a trail that welcomes you in, and it has a bench where one can sit and enjoy some soft fascination moments. So I really loved this little vignette within a much larger area.
Kathleen, thank you so much for joining us here today, and sharing this update, on your talk from last year. This is it's just so significant, especially in these times, right? That we have these reminders, right? That what we do as master gardeners can have a very positive impact, not only on ourselves, but on our communities and on the folks that we serve. Thank you so much.
You're welcome. Again, pleasure to share this with you, and be well, everyone.